frequency because that bacteria is irritating. You want to do a culture. Start off with a broad spectrum and end up with a specific antibiotic. If it's in the kidney, it's definitely more serious. Going to have basically the same symptoms. In addition, you will have generally a higher fever, and you're going to have flank pain. And the kidney is going to be tender and sore. In addition to the antibiotic, you want plenty of fluid. You want to dilute that bacteria, ease that irritation. You want to keep the kidney and bladder acid. These bacteria don't like acid. Okay, glomerulonephritis. Okay, that's when at that Bowman's capsule, and all those capillaries, you have an antigen antibody reaction, generally caused by post-streptococcal infection, could be other bacterias. A lot of inflammation decreases the filtration, causes pressure, start to leak protein and blood into the urine. Protein, blood in the urine, makes that urine cola colored. Decrease output, increase BP. Face tends to get puffy. They're leaking some fluid into the tissues. It's generally self-limiting with no permanent damage. Renal failure, acute. Acute means it's temporary usually. One of the main causes is decreased blood flow. The kidney does not like decreased blood flow. It has its own hormone to increase blood flow to itself. Renin is converted to angiotensin 1. Lungs convert it to angiotensin 2. Angiotensin 2 stimulates the adrenal cortex to increase aldosterone. Which means you increase sodium chloride, lose potassium. That'll kick in your pituitary over here to release your ADH, making you increase fluid retention.
What is ADH? What is
Angiotensin 2 also vasoconstricts your periphery so that it shunts blood to the kidney. That's how the kidney tries to protect itself against acute renal failure from decreased circulating blood volume. Of course, chronic kidney infections can cause it.
no?
And basically what happens is you have decreased or no urine output. What urine you have is very concentrated. What happens to your blood pressure?
Increase.
Up, because you're not putting fluid out. And that's the danger, the hypertension and the complications hypertension can cause. Not to mention your BUN and creatinine are building up, and those are toxic to the brain.
So, is that happen with a chronic?
Pardon?
So, is that happen with a chronic renal failure or acute?
Does that happen with chronic renal failure?
Mm-hmm.
BUN and creatinine buildup? Yeah,
Okay.
yeah. Basically, chronic renal failure ending with no kidney function. Basically, the cause is chronic kidney infections, chronic hypertension, because the hypertension is like beating a hammer on the kidney. You see it a lot in diabetics because of the hypertension they tend to have. And also in diabetics, that blood vessel that leads away from the kidney tends to constrict. So you have a 6-lane coming in, you have a 2-lane going out. We all been on the interstate when that happens. Builds up pressure, destroys the kidney. So, not only do you have problems with BUN and creatinine, then you have increased potassium, you have increased hydrogen. So basically, you are in metabolic acidosis. Because the kidney is not getting rid of them. It's toxic to the brain, causes hypertension. Start to spill protein in the urine. That's I can't even stop when I'm writing. It's probably not spelled right. Microalbuminuria. In other words, you've got protein in the urine. You should never have protein in the urine. So, hypertension, buildup of toxic waste, toxic to the brain. Only solution is dialysis. Kidney transplant. If they continue to live the lifestyle they do, kidney transplant will be killed just like the original. So, basically the bad thing is hypertension and toxicity to the brain. Not a good thing. Okay, any questions about the kidney, renal system? Respiratory system. Basically, anything that attacks the respiratory system, it's inflammation. Whether it's the flu or pneumonia. Your small airways with your alveolus. Can either clog up with edema, increased mucus, can clog up airways and decrease O2 in, CO2 out. Your alveolus is only 1 cell thick. If you get edema and exudate, increasing the amount of surface that your O2 has to go over, and your CO2 has to go over, and once again you have decreased O2, you build up of CO2. So, your pneumonia, flu, that's what they do. Basically, what you need to do is antivirals, antibiotics. May need bronchial dilators. Expectorants help you get the gunk out. Mucolytics to help liquefy the gunk. And you have asthma. Asthma is an inflammatory response to something that's actually not harmful to your body, generally. Causes excessive mucus, it's really thick. Bronchial spasms. So it's difficult to get good air in, old air out, they start building up CO2. Basically, in an acute attack, they need albuterol, which is a bronchial dilator. They have what they call their rescue inhalers. If their asthma is chronic, then they'll need preventive meds, which are your mast cell stabilizers. That's what happens in asthma. Your mast cells in your lungs break down and dump all those inflammatory chemicals. They need steroids. How do you want to give the steroids? Inhaled, so you decrease systemic side effects. They also need long-term bronchodilators. Bronchodilators are what type drug? The happy drug. The Red Bull drug. Adrenergics. Your adrenal. So adrenergics hype you up. So basically, it's better to have them inhaled also. Decrease the systemic side effects. Generally, asthma attacks do not exert permanent damage, not cause permanent damage, but if they happen too frequently, they can eventually cause damage. What should they do every day to know whether or not an attack is imminent? Peak flow meter. Stay in the green area on their peak flow meter. They get in the yellow area, they need to do more preventive. Because an asthma attack doesn't just suddenly occur most of the time. It builds up. Your chest starts to feel tight, feel a little more short of breath. And then all of a sudden the acute one rains down on them. Okay, your COPD. Basically, COPD is divided into chronic bronchitis, which deals with the upper airways, the big ones. Chronic bronchitis. You have chronic inflammation of the bronchi. Your mucus cells enlarge. You have a ton of mucus produced. You're coughing all the time, coughing up gunk. And that chronic inflammation starts to cause the bronchi to lose good muscle tissue and put down scar tissue. When you put down scar tissue, you can't enlarge your bronchi to get more O2 in. They're known as the blue bloater because they are constantly coughing, they're turned blue, gray, ashy, going to cyanotic. Also, core pulmonale occurs earlier. And that's when the lungs cause the heart to fail. Because that right side of the heart is pushing blood to the lungs. When you're not getting O2 to the lungs, you get vasoconstriction. That causes pulmonary hypertension. That makes the right side of the heart work harder. It's going to fail. Decrease O2 coming from the lungs. It's going to make your left side fail. The left side's going to hear those cells screaming for O2, and it's going to try to work harder to get the O2 there. With your emphysema, that's in your lower lungs. emphysema, that deals with your alveolus. They turn from lice, grape-looking things, into one big balloon due to inflammation.
What?
Don't touch your head.
Are you talking about mine?
It's gone now.
gone.
Okay,
It was,
good.
It went up. Okay, so basically, you start trapping CO2 because those little airways that lead away from your alveolus cluster start a product of inflammation. It weakens those muscles. They start to collapse in when you breathe out. And when they collapse in, you trap CO2. So basically, they start walking around in respiratory acidosis. If they're stable, their kidney can increase the bicarb and make their pH normal. So, problem with emphysema, trapping CO2. Also, the problem is those enlarged alveolus start to cause problems. They're putting pressure on good alveolus. They're putting pressure, there's no extra room in there. You get a barrel-shaped chest. And that barrel shape becomes fixed. You can't expand and contract the chest. So that what they do is they enlarge their neck muscles so that they're picking up that whole chest. So eventually they get where they're sitting up all the time. Usually you have a combination of these two. Eventually this one will lead to cor pulmonale as well. All those enlarged alveolus are destroying the capillaries that feed them by putting pressure on them. Once again, causing pulmonary hypertension. COPD is a chronic disease that meds help for a little bit. Your anti-inflammatories, your bronchial dilators are help for a little bit, but eventually nothing works. Cardiovascular ones. Hypertension, known as the silent killer. That's because it generally has no symptoms. Its target organs are the kidney and the eyes. Leads to arterio and atherosclerosis, which are narrowing your arteries. Medications to fight hypertension. Decrease volume with your diuretics. You have your potassium losing, potassium spare. So decreasing volume generally is the first line of defense. Vasodilation, second line. inhibitors. They're good particularly with your diabetic because they keep that efferent arterial leading liquidity open. Your angio conversion blockers. Decreasing cardiac output, your beta blockers. You can also help with your vasodilation. I've got nitro. Nitroglycerin, it decreases the preload, decreases the afterload.
It decreases the.
Yes. Vasodilates. You vasodilate, you decrease the amount of energy it takes to pump blood out of the heart. So, that's how you get the blood pressure down. If you build up those good old plaques in your coronary blood vessels, you're going to have angina. Angina means that you're not getting sufficient blood flow to support the heart and whatever it's doing. Sometimes if you just stop doing what you're doing and add a little bit of nitroglycerin, then the pain stops. But it's an indicator that you have decreased blood flow to the heart. You need to have a good old cardiac cath. See if you need a bypass. If you don't get that bypass, or don't get it soon enough, and a clot, one of those plaques breaks and clot goes loose, plugs up one of your coronary arteries, you have a myocardial infarction. Destroys cardiac tissue, replaced by scar tissue with no yield. That compromises the amount of cardiac output. MI, you're looking for your cardiac enzymes being elevated. Nitroglycerin to reduce the workload. Beta blockers can help reduce the workload. May need stents inserted to open up coronary arteries. Peripheral arterial disease, that's your arteries generally in your lower extremities. Decreased blood flow. Means decreased sensation. Decreased color, decreased tint, decreased capillary refill, decreased movement. It's basically they can't walk as far because they get that intermittent claudication. Muscle pain when they're walking. They stop a minute, let the muscle catch up, and they walk on. Basically, the bad thing of peripheral arterial disease is infection causing amputation. A congestive heart failure. When the heart fails altogether, right side, it's going to back up in the veins. So you're going to have systemic edema. First it's going to be dependent, most dependent part. Then it's going to get generalized. Left side. Going to back backup in the lungs. Giving you pulmonary edema, interfering with oxygenation. Medications to help the heart increase force contraction, like your digitalis type drugs.
What?
Nitroglycerin can help because it decreases the preload and afterload. Basically, you suffer somewhat from decreased blood pressure because your cardiac output's down. There's decreased blood on the arterial side, it's all on the venous side. And diuretics to help get rid of that excess fluid. Any questions about the heart, respiratory? Moving on to our inflammation, immunity, blood. Immunity, remember, immunity, you either have it given to you through the placenta, through breast milk, through gamma globulin. Some you're born with. We don't tend to have mad cow disease. Okay. If you make it, that's active immunity. Immunizations give you active immunity. Being exposed to a disease gives you active immunity. Your immune system fails, and that leaves you wide open. One example is HIV. Goes after your specific white cells that go after specific bugs. Leaves you vulnerable to disease. So anything that comes down the pike you can get. And basically it leaves you wide open to a lot of opportunistic cancers, fungal infections. It's the same with drugs that go after your autoimmune diseases, like multiple sclerosis, myasthenia gravis, rheumatoid arthritis. You hear those drugs advertised, what do they say? Make you vulnerable to TB, vulnerable to any infections.